See, my guest room is like a disaster.
Hello.
Hi.
How are you guys tonight?
Good.
Good. I'm excited to talk to you guys about solution focused.
Great.
Thanks for having us.
Yeah. So basically, the way that our course is set up is that the students will read a bunch of texts and watch videos and read articles about the model for the first week. And then the second week, we kind of dive in and show like practical examples from people who have actually utilized the model in the field. And so that's what we're doing tonight. And so thank you all for kind of joining me virtually to talk a little bit about solution focused.
Great.
Sure.
So let's jump in. And if you guys don't mind, could you introduce yourselves and just give a little bit about your background? And then we'll jump into some of the fun questions.
You go first, Irina.
Good morning, good afternoon, good evening, all. My name is Irina Kolobova. I have a background in medical family therapy with a PhD from East Carolina University and a master's in couples and family therapy. From Lewis and Clark College in Portland, Oregon. Up until about 4 years ago, I was an integrated behavioral provider with various healthcare systems across North Carolina, and then I moved to Pennsylvania, where I was the behavioral science director with a family medicine residency program through Penn State Health. And in those years since then, I'm now a research scientist with a pharmaceutical company.
Cool. Thanks, Irina.
Just to explain why Irina took a minute to get her CFT, MFT thing straight, there's like a whole schism of CFT and MFT in the MFT world that Dr. Lax can talk to you about it another time, but it's really juicy. I am Aubrey Koehler, and I am a colleague of these wonderful human beings. We went through the East Carolina University Medical Family Therapy program just a few years apart. I went from ECU to Cardinal Innovation, well, first Centerpoint and then Cardinal and LME MCO in the Piedmont or Triad area of North Carolina, where I was an integrated care strategist. And for the past 4.5 years, I've been at a residency, a family medicine residency program as a behavioral health director and an assistant professor.
Perfect. Thank you, guys. Okay, so jumping in, I want to first ask kind of what initially attracted you all to solution focused as like a model?
Okay, if I jump in on?
Jump right in. Yes, I'll tell you what I love
Dr.
about
Koehler.
solution focused. Drew me as contrasting with more problem focused or problem based models where you're thinking a lot about what's wrong with the individual or with the situation, and instead thinking around what's going well and how do we expand that. Mm-hmm. So the visual I like to think about is like a pie chart. And when a client comes to you and says, I'm really struggling with this part of my life, and that's what has initiated them to come to therapy, you can imagine that's like a section of the pie. Hopefully it's not half the pie, maybe it's a quarter of the pie or a third of the pie. And the rest of the pie is other things, maybe going okay, maybe going well. We don't know much about that yet. But with a more problem-focused model, you are thinking about how do I shrink that third, the problem of the pie, to be smaller and smaller until it's almost non-existent. In a solution-focused model, you're thinking about how do I expand the good part of the pie so that smaller part, that third, gets smaller and smaller. And a lot of the conversations, rather than being pathologizing around that 1/3 of tough stuff, is more positive and hopeful around that 2/3 of stuff that's maybe going okay. And I found it much more inspiring and hopeful as a therapist to be talking about the 2/3 of what's going okay or well versus spending all my time talking about the 1/3 that's going poorly.
Awesome.
I really like that example. I've never thought of that, but it's, I think, a really great way to think about solution-focused therapy. And I think to what Dr. Koehler said, just around the positive and the focus on not the problems, but the focus on how do you move away from these problems and tie back really into the things that are going well and the solutions going that you can integrate and implement. are part of what brought me to it, but I think what brought me most to it is that having worked with lots of marginalized communities prior to going into my master's program, it resonated with me as a model that really embraces resilience and empowerment. And I
Mm-hmm.
think there's this innate stereotype or bias against families who are really struggling, that they don't have things going well for them. And I think
Mm-hmm.
solution focused gives you that opportunity to work with families, to empower them, to remind them that at ultimate they're in charge of their lives. And if they want to see change in their lives, they need to bring this into fruition. They need to speak this out. They need to make this their truth. And you as a therapist or me as a therapist can sit along them and think about what does that look like when everything is going well, or 10% of things are going well,
Mm-hmm.
that I can help them envision that, picture it, and then think of the next steps so that we can get there. And again, whether that's 10% or 50%, it gives
Mm-hmm.
families, couples and families really a place to start and to hope, and really reinforces the resilience that every single person has that we interact with.
I love that. Oh, go ahead.
You made me think of like the idea of things being about us without us, which is often what marginalized communities feel like when they walk into healthcare settings, uh, versus bias for us. Like this is something that we are creating with the client so that they can be involved in the solution rather than just having something imposed on them or told to them,
Yeah.
which is so often the case with more of a expert-based type approach.
Mm-hmm. I love what you all are saying too, because it's, I mean, really, if you think about kind of the time period of when solution focus and even narrative kind of came about, this like postmodern period, it was so innovative, right? Because everything up until then was so like problem root based. Like we have to get to the root of this problem, the root of everything. We have to talk about the root causes before we can kind of, expand and think about your life being in a different way. And so this is such a stark contrast to that, right? That's not kind of the purpose of what we're looking at. And there's so much evidence that supports solution focus, which is so interesting, right? Because as therapists, we're taught like we got to figure out what the problem is, like what caused this. Let's start back when you were a child. What was your family of origin? What were all these things you experienced that kind of created who you are and some of these maybe problematic behaviors? But we know that there's so much evidence now for solution focus that doesn't look at that, right? And not that you don't acknowledge the problem, but that's not the focus of treatment, and that you can get better and improve without doing that, right? Without that being like the sole focus of treatment. So
Yeah,
what?
and I think
Oh,
in that
go
way,
ahead.
I'm very much not I am a postmodern therapist, and that there are lots of patients and clients out there in the world that the time that you spend digging to find what the root causes of the problem is doesn't help them to get to the solutions. In some ways, I do believe as a therapist and grounded in the work I've done over the years, that if you spend all this time digging through everything, you're trying to find the root cause, you sometimes are going backwards. You're taking away their resilience, you're taking away the power, you're already taking away all of the coping skills, some healthy, some not, that
Mm-hmm.
they've already worked through, and you're kind of getting them to restart before getting them to think forward into the future. So for me, I think that's just a different way of thinking.
Mm-hmm.
And I think as you'll learn through your programs that there are different types of therapists and there are different types of clients, but to also be flexible to know when it's a great approach for a certain client and when it's not.
Mhm.
Because sometimes digging through that past, it becomes secondary PTSD and additional complications and challenges that may
Mm-hmm.
not be the best option for every client that you interact with.
Right. And I'm anticipating pushback around like, well, does it mean that solution focus is just more superficial? And that's not at all the case. You
No.
are meant to work with what your clients bring. And rather than being a archaeologist who's like digging, you're someone who waits until when something bubbles up, you work with that. That's what's relevant. And if there's something in a client's past that's not affecting their present or their future, there's no functional impairment, then who am I to say that needs to be unearthed and looked at? It's sitting there. Maybe it's there theoretically, but it's not causing any problems. And there's really no need to unearth something that's not causing any sort of distress or functional impairment or limiting that person's desired future.
Mm-hmm. I love all of the like analogies and metaphors you're bringing tonight, Obs.
Oh, thank you. That's how it makes sense for me.
Okay, I mean, you kind of started with this, but what do you all see as kind of the benefits of solution focus? And you kind of hit this a little bit, but I wanted to kind of leave space if there was anything else you wanted to add about we talked about the marginalized community and how this just it feels like such an approach that highlights resiliencies and strengths that not that the therapist creates because we don't, that we highlight and uncover and kind of shine the spotlight on for the patient or the family. So, what other benefits do you all see from a solution focused approach?
So for me, I think it's a lot about empowerment. I think solution focus is really grounded in the client or the patient is really the expert. And so through the work you do as a therapist with clients or patients in this space, you're really empowering them to take the things that are working well and amplify them, make them a constant of their lives because you you believe in them that they know how to make their lives better already, and you find those examples, the small examples, whatever it may be, to help them really trust themselves and empower them to believe in themselves so that they can continue to do those things forward. So for me, I really think about that empowerment piece with solution focused.
Mm-hmm.
Another benefit, benefit feels like maybe not quite the right word, but something that makes solution focus really engaging and powerful is the focus on the postmodern focus on language and having the social constructionist viewpoint of the power around language itself, something that we often take for granted, like that's our primary tool as a therapist, and just hovering over that with an additional acknowledgement that it's not just the intention of our words, but the actual words themselves and how we phrase things, that can be really powerful in adding to that empowerment for the client or patient or detracting from it. So an example would be this often comes up in medicine as well, but having more patient-centered or client-centered language versus problem-focused language, rather than saying the anxious patient or I understand you are depressed or you have been depressed, asking about the depression. So tell me about the depression. That's a really nice way to externalize sometimes as a narrative. So narrative and solution focus have some really nice overlaps. Mm-hmm. So as a narrative, solution focus also talks about like how can we phrase something and talk about it so that it's not assume that it's part of this individual's identity. So asking questions like, what would you call this thing that we're talking about? And then how do we talk about it as an entity outside of you? Like when you are having the anxious feelings, what does it look like? What does it feel like? Versus tell me about your experience as an anxious person, which is a totally different frame and makes it really hard to imagine yourself as a patient or client as someone who doesn't have anxiety or who doesn't have depression. So I just think something as simple but also complex as language being really central. I've loved that piece of solution focus.
Yeah, I'm glad that you mentioned the narrative and solution focus overlap because we've had some questions about that. And so I've tried to kind of explain that already. And I think a lot of the terms they'll hear, like for narrative, they call them unique outcomes, and we would call that solution, we'd call that exceptions and solution focus. So there's some language where it seems similar. We just might have a different term for it. And you all started kind of going into this already, but I'm curious if you can say more about this idea of, and this is not specific to solution focus, but maybe more a postmodern perspective of kind of the not knowing, of kind of the role that we take as therapists as not being the expert, and as like new therapists who are learning and developing these skills. How do you know the difference between like having expertise, which we do as therapists, and then also like not being the expert, right, on the patient's life? And so what can you all kind of say about that component of solution focused?
I was just on the floor.
I mean, I can speak to that. I'm happy to start with that. So I think there's a difference between being a expert therapist
Mm-hmm.
and being an expert in someone's lives. And at the
Yeah.
end of the day, I'm an expert therapist. I understand the process of therapy. I understand how to get patients from one point to another. I understand when patients are stuck and how to get them unstuck. I understand when patients are shutting down. Like, I understand the verbal and the nonverbal happenings of the process of therapy. But
Yes.
no matter how much time I'm going to spend with a patient and another human, I am not an expert of their lives.
Mm-hmm.
And in those, depending on what setting you're in as a therapist, you might be spending 15 minutes with a client a week. You might be spending 50 minutes with a client a week. I don't know what's happening in all those other days, hours, minutes of the rest of their days. So I think that's a really important difference to understand, that just because you are not an expert, because you take a non-knowing stance to the person who's in front of you, it does not mean you're not an expert. You are still an expert therapist because you're an expert in the process of therapy and you know how to get them to move. But no matter who I'm with, I mean, I'm not an expert in the lives of most of the people around me.
Yeah.
So how can I be an expert in someone's life that I know for an hour a week?
Yeah, I love that distinction that you're the expert in the process of therapy. That makes it that's such a kind of a simple kind of way to send that home.
I think about the way, and I'm currently in a medical setting, so I'm doing a lot of residency education and thinking about how do physicians think about their expert role versus when do they need to listen to the patient as an expert. And it's actually quite similar. So if you try to think about it in that setting, if a physician does a poor job of assessing for what has the patient already tried, when did the problem start, how did it show up, what are they willing to do to engage in treatment, what are the resources like to get to treatment, what are their beliefs around what caused the problem and what will fix it. If a physician does a poor job of assessing that, the patient is not going to either find the treatment effective or won't engage in it at all because there are too many barriers or they don't understand how the treatment fits with their conceptualization of the problem. So even when you think about like a more seemingly black and white science-based modality like medicine, not to say solution focused is not science-based because there's absolutely evidence there. There is a need for that kind of gray area of like, let's create this together. There was another piece of that. I guess I'm right. I'm hot on these analogies. The client comes with like a box of puzzle pieces. Like they've got the pieces, but you might be able to say like, let's talk about what the frame looks like. Like I'm going to give you a strategy to just look for those edge pieces, and then let's think about. I see like this pop of orange. Can we talk about that and like sorting some of those pieces and getting those to fit together? So I think there's expertise in the process, absolutely, and in solving challenges and different gaining different perspective, but it's not an expert in I'm bringing the pieces of the puzzle. Like if I try to do
Yes.
that, they're not going to fit with what the client already has. It's like two different puzzles trying to fit two different puzzles together.
I really like that analogy. You are
Perfect.
on it tonight.
I'm on fire with them analogies.
I feel like you need to do like a children's book of solution focused narrative or something to like draw out all of these pictures you're talking with us about.
Yeah,
Happy to.
I like that puzzle, and I will use that one again. I don't own
um,
the puzzle, but I can help a client put it together.
Yeah. And what I love about that is that as we were learning about postmodern and social constructionism, one of the kind of critiques came up as the students were kind of processing and talking about how different this is from kind of a modern lens. And it was kind of brought up that was like, if the patient was the expert on their lives, why would they be coming to therapy, right? Which when you kind of think about the way that you all are kind of languaging this, right? And that you're not creating, again, we're saying this over and over again because it's true and we want to send this message home. Like the therapist isn't creating these experiences, right? These or these resiliencies or these things that are kind of going well in their life. We're just highlighting the puzzle piece, right? Or helping kind of fit the puzzle piece together in the right place, or allowing space for the identity about that problem narrative to quiet and kind of expand space for other alternatives. So I
I
appreciate
thought
you
of
saying that.
something I didn't want to forget.
Yes.
So the earlier solution focus, so the solution focused theorists, practitioners that I read most when I was in training were Steve DeShazer and Insoo Kimberg. They were actually married. So there are many great books, but those are the two greats that stand out for me. And they talked about how the client has solutions and resources. We need to use those. I don't know if it was a decade or 15 years out, a critique of that, a feminist family therapy critique of that is not every family or every individual has the same resources or access to resources. So the proposed change in wording was that clients have solutions and are resourceful. So it might be that we need to pitch in with more access and resources, but we're still retaining that belief that in the presence of resources, this client is resourceful, can connect with those resources, can use them to meet with the solution. So I thought that was a really helpful adjustment in the evolution of SFT from has resources to is resourceful. And that also helps guide us as clinicians with where we might be bridging the gap. Like we don't have to do things for clients, but we might help close access gaps so that they're in front of the resource and they can then take the steps necessary that maybe another client just has like ready access to.
Yeah. I love that. Thanks for adding that distinction. Okay, so let's kind of jump into any kind of examples, real world kind of experience or case studies, any kind of however you all kind of want to lay it out, but just kind of give us some, I guess, some experience or times that you've kind of utilized this model and it was helpful or effective, and kind of what that process looked like, to kind of help us understand a little bit better what this could look like in a real world scenario.
I'm pointing you, Obs.
I was thinking about what it looks like in the therapy room, but I can certainly talk about it there. Talk about that in this answer. So I'm thinking about the moments when you first meet with a client and you're wondering how to find kind of that part of the pie that is positive or neutral when they are here because they're having a hard time.
Yeah.
It's often a bit of a adjustment for both the clinician and the so there's some training of the client to start thinking differently about what's going on as a piece of the whole puzzle and not the whole thing. So some specifics at a baseline, I can always compliment the patient, the client, on showing up. So even if they bring no other observable resources or access to solutions or strengths, I can say, I'm so impressed that even with everything that's going so poorly right now, you're telling me about all the things that are so hard in your life. You found a way, you found the time to come here today. So in a real world example, I'm thinking about an individual I worked with who was extremely successful in her, she was in a graduate program and was really struggling with feeling worthy in that. There was a lot of internalized expectations from her family and this sense of like never being good enough, even though she was working pretty much day in and day out and not really making time for social activities or hobbies or just time for herself. So I began the inquiry of trying to understand more about what was bringing her joy. Like when she did break away from this hamster wheel, I wanted to know what did that look like for her. And another early solution focused intervention is to ask, like, what do you not want to change? Like, what is actually going well? And sometimes it's a homework at the end of the first session, or you can talk about it within that session. But she was able to identify, and I was able to appreciate and see, like, here's someone who has a multitude of interests and talents that are really dormant right now because she's so overwhelmed by her work and the expectations she has of herself. So through therapy, we were able to expand upon her existing social relationships. So she was drawing upon those supports better. And she was also having more direct communication with family and also setting boundaries so that when she was taking time for rest or maybe going off the path of where her parents would expect her to be, socially, or I think in some cases, like who she was dating, things like that. Being able to like turn off her phone or not answer the call or text back when she was comfortable. So we didn't fix the fact that she was incredibly, I mean, it wasn't necessarily a negative that she was incredibly driven in her work. It just needed balance. And it needed to come from a place of her own drive for success, and for this field that she was invested in versus this internalized expectation from outside. So there's that perspective shift of who am I doing this for? Why am I doing this? She still carried on in the same field. It's not like she dropped out of grad school and found a different field. But she was after that for her own edification and for her own interests rather than this internalized sense of guilt and obligation to her family.
Awesome. One of the things that I've kind of read as a critique, right, is this idea that, and I'm saying this coming from, you all know, in school, I was really passionate about Bowen, right? That was obvious, and also a terrible fit for the rest of the postmodern world. But one of the things that I would highlight for patients with Bowen was the idea that we have to fix the foundation, right? So like I would give analogies about like, okay, we need to fix the foundation of the house, not just like replace the broken window. And so that was my idea, right? And my understanding of like, we need to go back and figure out like what's at the root of all of this kind of dysfunction. And so one of the critiques, right, for solution focus is that we don't kind of if we don't do that, there's not going to be kind of long-term change. But you just reminded me of that when you said like your perspective changing, right? And that's the idea. And what we know from research is that walking patients through those examples of kind of what, like you described, Aubrey, of like what is currently unearthed, what is causing dysfunction right now, walking through the examples of how to get through that and manage that allows them to use the same strategy in the future. And so I wanted to highlight that because that's one of the critiques that we often talk about is like, so you fix that problem, but how does that, relate to like other things that kind of crop up? And I think the idea, right, is that they're learning about the resources that they have within them and around them, and that they can use that kind of problem solving in the future, kind of moving forward in the same sense. So
and the exception, or one of the early exceptions for her, would be times when she did successfully say, thanks for calling mom, but I'm going to have to call you back, or no, I'm not going to be able to come home then, or I'm really tired. We'll have to talk about this at another time. So when she was successfully able to do that, and we could better understand what was at play when she was more successful in those exceptions, and expand them, well, then she has this intensified sense of agency. Like next time my mom is going to call in this way that I experience as intrusive, I'm going to trust that if I don't answer the phone, the world will not explode. Even though I've been trained throughout my childhood, adolescence, 20s, etc., to be obedient to my parents. So those exceptions can also be corrective experiences, and something that we're more likely to return to, because we catastrophize until we see that we are successfully navigating it. And yeah, maybe mom's annoyed, but she's not disinviting us from holiday get together.
Yeah. What other, I'm glad that you brought the exceptions piece up. Are there other techniques, whether either with this particular case or if you all want to expand in general, are there other kind of intervention or techniques that you all found yourself using more than others? I mean,
I'm a left
obviously,
brain.
oh, go ahead. Go ahead.
I'm a left brain person, so I often used scaling because it would help me to understand where the client really is.
Yes.
For me, that was just a really important way to really know where they're at. What's their likelihood to commit to this next strategy, or how they're going to integrate into something, to understand how dedicated they are to the certain piece that they want to move towards to, and how stuck are they in with what they've got going on. So I use scaling questions of all types, beyond just the way that it's written about in the theory books.
Yeah, I love that. One of the things, Irene, I don't know if you ever had this experience or Obs if you have, but I remember one particular case in integrated care where we kind of went through this beautiful intervention, provided all the psychoeducation, created this beautiful SMART goal, and was like, okay, this is great. And then do the scaling question at the end of the assessment, and I'm thinking, oh, this person's a 9 for sure, right? An 8 or a 9 for sure, and it's like a 3. And I remember thinking, what did I do wrong? Like, where did I miss the mark? That I thought all along, your engagement, your excitement, we're talking about SMART goals, this seems like realistic for you. You seem excited about it and engaged. And we get to the end and do that scaling question. And it was so telling for me and such a good reminder to slow down and not do that at the end of the session, first of all, right? Because that information is so critical in figuring out, are we on the same page here? Like for that particular scaling question, right? It really allowed me to see, okay, my perception of how this is going is very different than them, and it was a good reminder of the usefulness of that question, and not just walking out of that room and just assuming we were on the same page. So yes,
That's such a good hop back to the non-expert approach. That
yes,
if you present as the expert, on high, you make it easier for yourself in the moment because you don't give the clients an opportunity to tell you what about your approach or hopefully the approach that they're helping craft with you is not going to work. So it's
yeah,
like, how convenient. They didn't say it wouldn't
right,
work for them. They left looking really motivated, but
right,
it turns out they were just smiling and nodding, as we
yep,
do to authority figures. So
exactly,
choose your hard, right? Glennon Doyle, choose your hard. Do you want the challenge of being very I'm going to say authoritarian, which is extreme expert, but very presented as very much an authority, and have the ease of ending that session and feeling great about what an amazing therapist you were, and then the challenge of them coming back and saying,
mm-hmm.
or not coming back at all, right?
Yeah,
Because they're embarrassed that they didn't follow through, or coming back and it turns out they didn't make any change happen, or they might be inflating about how much they engaged in the homework, but then they haven't actually moved the needle. So that's your challenge. Or do you want the challenge now
right,
of them saying, I don't agree with any of this and I don't think it'll help me. So if
yeah,
you're going to you can
exactly,
either get the challenge today when
yep,
you present in a way that allows the client to say, this is not going to work for me, and you've given them an opening to do so because you have not presented as an expert in their lives. Or do you want to displace it to the future where they either don't come back because they're like, I don't want to face up to that expert who I didn't abide by, or they come back and say we're the same because they didn't do it. So
yeah.
I think, yeah, thinking about being accessible in such a way that they can tell you, I'm like a 2 when it comes to my likelihood of implementing this.
Yes.
I will add to that, as I got to know clients and had a full caseload over the years, my clients also knew I was going to scale them pretty quickly. When they said, this has been a really bad day, I'd be like, on a scale of 0 to 10, where are we at on this bad day?
Mm-hmm.
And it actually led to clients often giving me the number before I asked for it. And it got to me thinking that way. So it was a really
Love that.
interesting experience, because kind of going to that piece that we talked about where you take the strengths of what they've got, and they amplify it. when you use the scaling questions and get them to think that, okay, that was a 5, what would need to look different for it to be a 6? They themselves in their lives start being like, okay, if I want to get
Yes.
to a 5 to a 6, here's what needs to happen, and let me get that to happen because I want to be a 6 or
Yeah.
whatever there is on that. So it becomes this like bi-directional dynamic that I
Oh,
think is just such
Yeah.
a nice way that it evolves over time for the client and for the therapist, in that you get to know your clients really well through that way.
yes. And it's cliche. I think it's cliche because it's so good and that a lot of people use it. And it's also very common in motivational interviewing.
Yes.
But asking about, so if we say, we're at a 5, the client's at a 5, tell me why you're not at a 4. So that's the reverse of, instead of talking about how do we reach, which is great, how do we problem solve and reach, talking about like what's going well enough that we scaled it a point higher than we did last week, and like digging into that because that's your data. What brought you from the 4 to a 5? Can we replicate that? Can we do more of that? That's the good stuff. Miracle question is great as well. It's also cliche, and there's Steve DeShazer would ask that in a really like heavy visualized kind of way. Like you imagine you're waking up and you're like your first sounds and smells, and you open your eyes and you're slowly moving out of bed, and maybe you walk downstairs, and like at which point do you notice the problem's not there and what's different. So you can like make it very elaborate, or you can just be really simple and straightforward about like what would be different if the problem were not the problem. Like if this were, you woke up and it just everything that we're talking about today as being really this like tangled knot were just disappeared, what's different around you?
Yeah.
And it's really drawing on some of this like more subconscious stuff of like maybe the client hasn't pulled it into the front of their brain yet, like what is sticky and in the way, but asking them in this more like creative imaginative sense where they are drawing more up in this like right brained creative space. That's been really, it's
Yeah.
been fruitful for me to ask those questions, and at first clients are like, well, I'm here because I like
Right.
don't know.
Yeah.
I can explain, like, I want you to just start to imagine a world and a life where that's not like the first thing you're thinking about and like gnawing on when you wake up in the morning.
Yeah. I like how you language that, because I think sometimes people can be turned off with the word miracle, right? And so I like that when you are kind of framing that question, we're not saying, okay, the language doesn't have to be you woke up and a miracle happened, right? Like that's not how we kind of language this. And so kind of thinking about being intentional about how we talk through that. And I think even it's not even just I think you can go. I think even the founders kind of talked about this kind of being this like light trance or hypnosis almost, with this kind of visualization of what could life be, what would it be like without these restraints. And so yeah, I love everything that you're saying there. And again, languaging it in a way that's not necessarily saying the word miracle, because that might be a phrase that not everybody um,
Connects with.
Yeah, and I don't use the word miracle. I often think about it also in the future because I want it to also be somewhat attainable for somebody. So I would say a month from now, or whatever I think is where we're headed. I'd say a month from now you wake
Oh,
up, tell me about your 5 senses. What is different in a month as it is today?
yeah. Oh, okay.
Um, because I want them to, and then what I liked about using that approach versus kind of saying, okay, you wake up tomorrow, is that then I think about, okay, if this is your dream or where you're standing, where you want to be, your goal in a month, well, let's think about what's really practical to get us even closer to that. So it allows us to have a time relationship to that miracleness.
Yeah.
Yes.
Love
And
that.
it's good assessment too, because never assume that you and your client have the same idea of like what solved looks like. Like I've had
Good point.
it's uncommon because usually clients will stay in therapy as long as you let them. But I have had clients who are like, I got what I needed. And I'm like, really? Like, this is as far as you need to
I'm that
go?
client.
Like, great news. I feel like I've been so efficient that after 4 sessions, you have all the therapy you need. But
Yeah.
them, the way they've defined the problem and the solution, like they feel empowered to go. And I think that's great. So sometimes the miracle question can help with understanding what they actually want to see changed versus maybe what I would want changed if I were in their lives. And again, stepping out of the expert role to make room for what they really are looking for in therapy. Yes, of course, if they're hurting someone or themselves, that's an ethical consideration. And outside of hurting themselves or others, they're free to choose what they want their lives to look like.
Mm-hmm. Love that. Before we move on, any other comments about like examples that feel relevant to share? If not, I think that was really fleshed out, but just wanted to make sure.
If something comes to me later, I'll mention it, but I think I'm good for now.
Okay.
I've got like more examples for us, or 5 more analogies for us.
Right. I've got analogies. Case reports aren't as much fun, clearly. I try to generalize into an analogy. That's my style.
So what do you all, what have you seen, or do you believe, if any, to be some limitations of using a solution-focused approach?
So I've been thinking about this one as I read through your questions, and I think the one time solution focused was a challenge is I was working with a cultural group who historically, internally, and culturally really does believe in that the therapist should dictate the course of therapy. And so it was really hard to navigate some very kind of strict cultural norms about what healthcare is. And it's not a patient centered approach, it's a hierarchical approach. The doctor's in charge, the therapist is in charge. You tell me what I need to do. So I think that's the one time I've really challenged. Though over the course of time, I was able to get this family to move closer to embracing their resilience and their control in the situation. But that was one I do vividly remember this. This was actually probably right after my master's. And I was working with a lot of refugee populations.
Yeah.
That I had just one family that really stood out to me, and it took a bit of a finessing. But I just remember the dad saying to me multiple times, "Well, you're the expert. Tell me what he needs to do. Tell me what I need to do." And so having to like slow down also to recognize the cultural differences in that approach
Yeah.
was a really good learning experience.
And that's also nerve-wracking because you're a new, especially for new therapists.
Oh yeah.
You're like, listen, I'm really not the expert, and also I'm really not.
I was like, where's the
Dr. Brown, are you? And again, was really
vignette that you just shared with us.
Yeah, that was a perfect example.
But also just a really great example of my own humility, that as soon as I felt that uncomfortableness, I engaged my supervisor and really had this opportunity to grow and to reassess how to come back into that room and have the presence that they were looking for, because they're looking to somebody to trust and to believe that's going to guide them in the better direction, but also have the presence in the room to still say through other words and a different approach that I'm here to guide you. I'm not here to dictate what you do. So I think that's also a really fine-tuned type of language that you have to, with time and experience, you get used to it.
Yeah. I love that though. We've highlighted so much, and you all know I'm passionate about this, of course, because we're so close. But this idea of this constant kind of checking in, whether it's called supervision or peer collaboration or whatever it looks like over the course of your career. But I think from a postmodern lens, we do this so well, of just the value in kind of having that constant collaboration and checking in, and the humility to be able to recognize, okay, this made me feel a certain way in the therapy room. Something's up here. I don't know exactly what it is, but I know I need to consult with someone, and the ability to reach out and do that. So I'm glad that you hit on that, Irina.
Another example of a presentation that can be challenging for solution focused, or that I've been challenged to work with as a solution focused therapist, is this is one term that's used for this presentation. It might not be the most up-to-date term, but it's the masochistic patient. So the patient who's like really identifying with their suffering, and it's like a really big part of their identity. So imagine the person who says, no, everything's awful. No, I can't make any changes. I'm totally isolated in this. No, there's no one to help me. No, that won't work. Sometimes it's like the yes, but as well. So like you talk about resources and solutions and you think you're getting somewhere and they're like, yeah, but that wouldn't work. There's no way. And I have hit a total wall with my solution focus with patients who present in this way. And the antidote for me has been like validation station. Like, you're right. This is awful and you're so stuck. Yes, it is so hard. You are suffering so much. Oh my gosh. Yes. How awful. What are we going to do about this? So it's a reminder for me to slow down and realize that this person is not ready to think about solutions because they are totally enraptured by the darkness, not in a way that's helpful to them or that they want to be, but that's like they can't see beyond it. And it's been helpful to validate, and turn the solution into another hard thing. So like they're used to hard things. So in the other example I gave about the woman in grad school, letting her know, you're right, setting boundaries with your mom is going to be so hard, but worth it because there will be some freedom for you on the other side. So there was a little bit of a hack in her case or in other like tough presentations where like the hope is just really far from view. Where I almost had to turn the solution into something that was going to be a little bit problematic so they could like sink their teeth into that. Like, yes, I'm going to fight against that. And then maybe be in a better spot than if I just passively like allow myself to be bulldozed by my existence. So I've had to like kind of craft different versions of solutions for patients who present as like long suffering, probably would be another way.
Yeah.
Martyred.
Yes. That's good to know because we all know those patients and those I know that's anxiety provoking a lot of times for I mean that's a hard person to be in a relationship with in any type of setting, but certainly as their therapist, right? To be the one that's constantly you just feel like you can't connect with. And so I like that you went back to validation because that's my go-to too, right? Is what's your relationship? What's your relationship like with that person, you know? And let's build that as and hope that kind of over time we'll be able to get somewhere else. But
and one more contraindication thought or just clarification thought that like there's a fine line to be walked. There's by no means meant to be a making light of like awful situations. So someone who's in a toxic environment at work or in their home or is being mistreated in some way or is mistreating themselves, we're not trying to make sunshine and rainbows out of suffering and dysfunction, but rather to speak to what else is there in this picture, because you are more than just this one thing, and you have more relationships in this one toxic relationship and more environments in this one toxic environment. So I would just want to make sure that the students didn't think that this is only something that can be used for people who aren't in who already have a pretty sunshiny situation. We are never trying to tell people that they should be happy about what they've got when they're like living in a cesspool or something. It's like, oh, where do you see the light when you're standing in the cesspool? How can we help you move towards that?
Yeah.
And the light might be huge or it might be tiny. It might be a pinhole of light. But I think that I do wonder, maybe I should just ask you, Miss Oz or Dr. Koehler, do you think that everyone has at least a pinhole of light?
I do. I think everyone has at least a pinhole of light, and that's the same mentality of if I can't think of anything else to compliment someone on, I can always say something in you wants to fight for something better, and that's how you got yourself to this seat today. Like,
Yep.
there are so many people who would not have made time for this, or who would have not caught the 3 bus connections, or found childcare when there was no one available, or brought their child and their child is making noise and they're still trying to focus on you. Like, yeah,
They're here in the room. Doesn't matter anything else.
right,
Yeah,
right.
absolutely.
I agree with you completely. And I think that's a really big part of the foundation for being a solution focused therapist
Yeah.
is you have to have this assumption that every patient has a pinhole of light somewhere.
Absolutely. Absolutely. I agree. Awesome. Thank you both so much for your time, energy, sharing your expertise with us. Is there anything that you're dying to say before we hang up? Okay.
I think you asked such great questions that we covered all the stuff we needed to.
Yeah.
Oh, thank you both so very much. I appreciate it.
We'll see you soon.
Bye.
Bye.